With Professor Steve Wesseling. He is the Executive Director of SAHMRI and also the Honorary Director of the NHMRC Advanced Health Research and Translation Centre. But coming back to SAHMRI, Steve is also the Infection and Immunity Theme Leader. So please welcome Steve.
Okay, thanks very much for the invitation, and I'm going to spend a little bit of time talking about the new Advanced Health and Translation Centre, and the slide that we currently have up is the cover of the application that we sent into NHMRC, and I actually believe we won the competition because of the picture on the cover, because this is a great picture, but just. Just to go to firstly an overview of the centre, and then perhaps talk a little bit about the history, and so really what the centre's done is to bring together. I'll just check that that's right. Bring together a whole state collaborative network. So what we've done, and I'll have a list of all of the members of the centre. We've brought together the state's academic research, healthcare delivery agencies, and really with the goal of ensuring that when we do develop evidence in health, that we use that evidence to improve health. And if I was asked, and I have been asked, why the SA Centre got up and not the centres from Queensland or Western Australia, then I think my answer really is twofold. One, we were able to bring everyone in the state together to write this application and truly work together on the centre. So we were able to bring together all the three universities, healthcare delivery, primary healthcare, secondary and tertiary healthcare, the research sector, Aboriginal health and consumers. So that was the first thing, and I think that's something that South Australia does very well actually. And in contrast to some of our interstate competitors. And the second was, in that, health actually came to the party, and I think that probably didn't quite happen in some of the other states, and so having health in this centre, and when NHMRC asked for these applications, they asked for the applications to come from health departments, not from universities, and not from MRIs or medical research institutes. And so ours was obviously delivered to NHMRC via David Swan, but health was intrinsic to the development of the Translation Centre, and it was actually around the same time that transforming health was occurring. So the two sort of came together, and at our interview in Canberra, we were able to talk about how the centre and transforming health and the local hospital networks were working together in a translational manner. So that was sort of, I think, an important part of the development of the centre. The centre focuses really on the tripartite mission, and that is research, clinical care and teaching. And I think Dorothy's outlined how those three things are inseparable really. And I think, unfortunately, in Australian health, we've often separated them. So some people do really good research, some people deliver good healthcare, some people teach, and in some circumstances they come together really well. And I think that's the outcome is obviously terrific. But often we separate them. We separate them because of funding considerations. We have multiple funders. Federal government's funding one part, state government's funding something else, and NHMRC funding something else. And I think the evidence from overseas is that if you can bring those together, you can do much better than if you keep them apart. And then the other thing that the centre really is about is acknowledging that it takes a long time for research to impact on clinical care and for research to impact on workforce development. And really I think the centre is predominantly about identifying those areas where we can more rapidly move knowledge that's already been developed into healthcare, and also more rapidly develop knowledge which we then more quickly move into healthcare. And I think you guys would all know the literature that tells us that it's 14 to 17 years for most bits of new discovery, whether that's at a biological discovery but also at a health services discovery, for it to move into healthcare. And really, if our healthcare is going to be better, we have to do that much faster. And then, as I mentioned, the intersection of the centre with transforming health was a unique opportunity, and I think enabled us to explain to the committee that interviewed us, which was made up of essentially deans from international medical schools, mainly the UK, and that we really did have that intersection with health. So just quickly, the history. I guess since SAHMRI started, we've been thinking that we needed a statewide, what I would call an academic health science system. And so it's based loosely on the academic health science centres and networks that are in the UK. And so we had already started that process. We'd worked with the Medicare locals, with the local hospital networks, and with the 3 universities, and they had all signed up to that concept. And then it says NHH, yeah, and MRC, so that's not entirely right. But then in response to the call from NHMRC, we were sort of ready, and we pulled everyone together that had been working on the Academic Health Science Centre and developed a statewide submission for the South Australian Advanced Health Research and Translation Centre. And I have to point out that that name, South Australian Advanced Health Research and Translation Centre, is a Warwick Anderson name. We added South Australian at the front, but they all had to be called Advanced Health Research and Translation Centres. The interstate centres who won, which are listed there, are changing their names, and so we're open to a new name, by the way. So something like, I mean, we're sort of using SA Centre at the moment, but a really cool name would be great. So if anyone can think of Guy Madden was in the lift at SAHMRI at the implementation subcommittee and hauled me up and said, "This name's terrible, we've got to get rid of it. We need a new name." I said, "Guy, we're getting a new name." But we're open to ideas. So NHMRC received 12 submissions from around the country. 8 were interviewed, as I said, by an international panel, including people like the Dean from King's, the Dean from UCL in London, and others. And now they were the 4 listed there winners. So the Alfred Monash group got a Guernsey, Melbourne Health with the Parkville Strip, Weehigh, University of Melbourne, Royal Kids, etc., got a Guernsey. We got a Guernsey, and Sydney got a Guernsey. And I think I'd just like to emphasise, I think that's a real coup for South Australia. I think it, as I said, demonstrated South Australia could work together. As you can see, we were the only statewide centre that got up, and I think it was a real coup to show that South Australia could work together to win that gong. Importantly, the gong came with no money, and the 4 nominal heads of those centres, we all went to Canberra a couple of weeks ago to talk to Anne Kelso, the new director of NHMRC, and told us she needs to give us some money, and so we're working on Anne to get some support somehow for the centres. But I think it really has, Western Australia and Queensland are very upset that they didn't win one, and I think it really gives us a bit of a lead in the area. These are all the centre partners, and as you can see, we've pulled everyone together. As you'll know, the Medicare locals have disappeared, and so the primary healthcare networks have replaced them. Aboriginal Health is in there, Health Consumer Alliance is in there as well. And this is the vision, and that is to continuously enhance the rate of translational research into healthcare to create a self-improving, high-quality health system which is also sustainable. So you can see a lot of correlation between that and what Dorothy was talking about. I think what we're saying is we can bring the academic arm to doing this, and we can bring the people in the state who are interested in improving healthcare through the use of evidence and the development of evidence. The goals were to align research, training and workforce development and patient care, the sort of tripartite mission. We put up 3 grand challenges in our application: healthcare integration and innovation, preventing and managing chronic disease, and the statewide translational health pipeline. Importantly, we've spent most of the time since we were awarded this talking about health services research, and I know that's what you're talking about today, but that doesn't take away from the fact that the centre is also about a discovery pipeline. So we're still about going from bioscience all the way to a drug target to a drug. What we're saying is this centre and its intersection with health and the universities probably is going to do more work at the right-hand end of that discovery pipeline than at the left-hand end. This is a bit of a, I think you can probably read it all right, but this is the governance slide, and I guess just to make a few points about this slide, the first is that the sort of council, which we've called the executive group, is chaired by Jenny Richter and myself. So we have this Deputy CEO of Health at a very high level within the centre to ensure that we do have that intersection at all times with health. All the partners are listed across the top. This executive group also reports to or tells the Minister what we're doing. The Minister, it's not really a reporting line, it's an indication to the Minister what the advice from this executive group is. Then we have the Translational Health Committee, which really is the committee that looks at everything the centre's doing, currently chaired by Paddy Phillips, the Chief Medical Officer and now also the Chief Public Health Officer. And we're making sure that this intersection again with healthcare delivery through the Minister's Clinical Advisory Committee that Dorothy talked about. We have purposely put a primary healthcare integration committee and an Aboriginal health advisory group there just to make sure that we don't miss those bits, because there is a risk, and I think Dorothy identified in Transforming Health as well, a risk that we're going to only concentrate on tertiary care. And then down here, where all the work gets done in these dark blue boxes, is the Translational Implementation Subcommittee, committees to develop resources and modelling, committees to develop translational methods, an evaluation subcommittee chaired by David Roeder. Ian Olver's chairing this committee down here. Dorothy's chairing this committee. We've got lots of good members of these committees, and right now that's where a lot of the work and frameworks for the centre are being developed. I'm moving reasonably quickly because I'm getting cards with numbers on them indicating that I need to finish soon. So I'll flip past that. We have looked at some of the things that we can do quickly in alignment with Transforming Health, and so here's a list of some areas that the implementation subcommittee is going to start to work on very quickly, and you can see they align quite well with the areas that Dorothy was talking about. But importantly, we want to make sure that we are helping and developing the evidence base for this work. We're developing the models to look at whether interventions are going to make positive impacts, and then we're making sure we develop evaluation frameworks so that we can actually measure in real time what's happening in those areas. And I must say, people like, I'll just give David Roeder as an example, are really excited about that opportunity to develop the evaluation framework, to look at interventions into these areas and see that they actually do have positive outcomes. But importantly, we're also keen for other groups who, if they came under the framework of the SA Centre, that would be helpful to them and are doing work that is translational and fits within the priorities of the centre. We're very happy for them to come under the umbrella of the centre. I'll just give 2 examples. The frailty group down at the Queen Elizabeth have been talking to us, and they probably will come under the umbrella of the centre, and an antibiotic stewardship in aged care group will probably come under, and we hope more other groups are keen to become part of the centre. We won't own them, but we can give them some. We can help them in an advocacy way. And the chair has stood up, and so I need to finish. And so thanks for the opportunity to tell you about the centre. It's obviously it's a big enterprise. It's complex. We have 5 years to deliver to NHMRC what we promised, and we're keen for anyone who wants to be involved, and we're keen for any advice and help.
Thank you. Can I get John Carnan to come up, because you're the first speaker?